Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Strategies for Fatigue. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join our community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask you to keep your microphone muted to eliminate any distracting background noise. Please feel free to enter any general questions into the chat function found at the bottom of the Zoom window at any time, and we'll get to them after the presentation. Without further ado, I'll introduce our workshop speaker. Dr. Philip Chang is an assistant professor in cancer rehabilitation medicine at Oschin Comprehensive Cancer Center at Cedars-Sinai Medical Center. He completed a residency in physical medicine and rehabilitation at SUNY Downstate, followed by a fellowship in hospice and palliative care at Montefiore and a fellowship in cancer rehabilitation at the University of Michigan. He has published on various topics in cancer rehabilitation and works with the Cancer Rehabilitation Physician Consortium of the American Academy of Physical Medicine and Rehabilitation. Thank you so much, Dr. Chang, for being here with us today.
Thanks so much, Rebecca, for inviting me to speak on this really widespread topic again. I don't know if anyone has heard me kind of give a very similar talk with cancer support community before, but yeah, it'll be a few updates, but not too much has changed in the last 2 years since I think I spoke on this subject. But hopefully, whether this material is new to you or old, you can take away something that can help either yourself or a loved one with this kind of ongoing issue of fatigue. And I think we're just going to be, if you have any questions, feel free to just type them in the chat, and then I think we'll be going over any questions at the end. But feel free to type them as they come up. So I don't have any disclosures. And to get right into it here, what is cancer-related fatigue? Fatigue is just a feeling of tiredness or exhaustion. And when it's cancer-related, it's generally in the context of having a cancer diagnosis or receiving active cancer treatment for a cancer diagnosis. And the differentiating factor really between cancer-related fatigue and normal fatigue is that when you're typically tired, it's usually because you've been working a lot or because you've just had a lot of activities going on, just being from one thing to another. So you're just everyone has a limited amount of energy, and you get more tired as you go through those energy reserves. But with cancer, it doesn't matter how much activity you're doing. Even if you're doing not that many activities, you'll still kind of be tired, and it can be absolutely severe enough to the point where it will affect your everyday activities and usual functioning. So again, normal fatigue, proportional to how active and busy you are, and typically if you take a nap or you go to sleep, you should feel like refreshed the next day and ready to kind of take on more activities. But with cancer-related fatigue, even if you sleep and you wake up the next morning or you take a nap, when you get up, you'll still feel kind of tired and won't really feel very refreshed. This is an extremely common problem, and basically it's one of the few things that I tell patients that they should kind of expect, especially if they're going to be starting on a new treatment regimen, that it will happen basically to everybody, 100% of people at some point throughout their cancer journey and treatment. And it can be significantly severe in 45% of people who are undergoing active treatment. And even when people are finished with treatment, fatigue can still occur, and that's absolutely common, and has been reported to occur in up to 30% of people. Yeah, at that point, we continue to call it kind of cancer-related fatigue. But for some people, I've definitely seen even a year, 2 years after they finished active treatment, they can still kind of continue to experience these kinds of symptoms, even though their treatment was kind of a long time ago. So again, this is like a severe thing that interferes with everyday activities. So like people have trouble going back to work, or if they didn't stop working and they're continuing to work during treatment, they have a lot of difficulty working. Just even going for a walk and going to their medical visits can be difficult. And whether they're caring for children or grandchildren, a lot of people just don't feel like they have the energy to be able to do those things. And for a lot of people, fatigue again is so severe that they just have to say no to a lot of these things because they're unable to do it. So what causes this kind of fatigue? And there's no short answer here, and there's no single factor that causes cancer-related fatigue. It's really a number of different factors that play a role in causing this issue. Now, that said, there is something different about, somebody who has a cancer diagnosis and someone who has a tumor somewhere in their body. So generally, when you have a tumor in your body, that area of the tumor that's made of the cancer cells, there's a lot happening there. So it's very dynamic. And there's, the body is, kind of trying to still attack the tumor to a degree. So there's parts of the tumor, that are kind of dying, and there's a lot of inflammation that occurs around the area of a tumor. And all that inflammation leads to release of something called cytokines. So cytokines are basically little chemical molecules that are secreted by cells, and that's how cells communicate with one another. But a lot of those cytokines and inflammatory molecules can kind of go to the brain and affect the brain with kind of a low level of inflammation. And that's one of the major things that we believe contributes to kind of fatigue and cancer. But like I said, a lot of other things going on. A lot of people are on various medications when they're, either medications for the cancer itself or for side effects caused by treatment. And a lot of those medications contribute to fatigue. A lot of people undergoing chemotherapy have reduced red blood cell counts, causing anemia. And when you have low red blood cell counts and low hemoglobin counts, those are the molecules that kind of transport oxygen in the body. That contributes to fatigue. And basically everything here and a bunch of other factors we're going to go through. But the short answer is that many, many different contributing issues contribute to fatigue. So we're going to just dive right into it and talk about different treatment strategies. So everything that I'm going to talk about today is basically from the guidelines from the National Comprehensive Cancer Network. This is like a big national cancer organization, and they set guidelines for treating cancer as well as for treating survivorship issues like fatigue. And they are pretty good about updating their guidelines. Not that much has changed in the past couple of years, but these are from their updated guidelines. So they basically have categories of evidence for each of their recommendations. And everything that I'm going to be recommending today is either category 1 has a category 1 level of support or category 2A level of support. So if it's category 1, and I'll tell you which ones are category 1, that means that there's a lot of evidence supporting that specific strategy in combating fatigue. If it's category 2A, that means there's not as much evidence, but there's some evidence. And there's uniform consensus among an expert panel that that is a helpful thing to do. So yeah, we're just kind of focusing on high impact strategies today, and generally almost everything we're going to be discussing today can be considered relatively high impact, but really pay attention to the category 1 ones, which I'll be pointing out. So when we talk about fatigue. And as we discussed, there's a lot of different factors that contribute to fatigue. So a lot of what we do is trying to reverse any of those factors that we can that are causing fatigue. And these are all the different treatable factors that may contribute to fatigue. And we're going to be kind of discussing each one of these and just going down the list here. So as it's not exactly proportional, but the more of these different things you can kind of deal with, the more your fatigue will kind of decrease. So it really is usually better to take a multifaceted approach and attack it from as many of these different contributing factors as possible. So the first one is just dealing with side effects from cancer treatment. So it's really, really common that people get nausea or bowel changes, or they have appetite problems, or shortness of breath, or any number of different side effects that can occur when somebody's on active chemotherapy or other forms of cancer treatment. So it's really important that you are working with your medical team, whether that's your oncologist, your radiation oncologist, or your supportive care medicine or palliative care provider. But whoever it is, they have to be helping you manage these side effects, because in managing all these things, it will decrease levels of fatigue. And that's what was actually shown in this study that they did, where they basically just had a group of people and they more strongly controlled symptoms in one group and kind of didn't control them as well in another group. But the patients who received the continuous monitoring of their symptoms and treatment of their symptoms, they had less fatigue after 1 and 2 months in this study. The next thing is emotional distress. Very, very common, I would argue normal, that when somebody receives a cancer diagnosis, that they have anxiety or depressed mood. And those things are just really, really common. And that type of distress, there's a lot of different ways that, practitioners can help to alleviate this type of distress. So all I can say in this area is that if you're kind of going through it alone, or you have a loved one who's going through it alone, just seek help. And there's like a lot of help out there. And I'm guessing no one, here falls into that group listening to this talk, just because you're already part of the cancer support community, and they have, so many great support groups and so many of these great talks that get put on. But there's a lot of other sources of support among your medical team. So clinical social work, I refer a lot of my patients to our social workers because a lot of times they can do kind of psychotherapy, which is just talk therapy. A lot of times it just helps to talk about, and actively express, what you're going through, and to have somebody kind of listen. Support groups, of course, can be helpful for a lot of people. A lot of medical institutes will have chaplains or some kind of spiritual care services. A lot of institutes will have psychiatrists that patients can get plugged in with. And then certainly at Cedars-Sinai, we have a lot of survivorship programs as well as supportive care programs. So again, if emotional distress is something you or a loved one is experiencing, just seek help. There's a lot of it. And there are a lot of, especially in Los Angeles, there are so many different wonderful organizations that can offer support in this area, usually through support groups or psychotherapy. But just to highlight, yeah, I would try to get plugged in with one of these things. Emotional distress is one of the bigger contributing factors. Infection is something that can occur, particularly for patients who are on active chemotherapy, just because a lot of active chemotherapies will decrease white blood cell counts and create immunocompromised state where your body is just not able to fight off infection very well. So common infections that can occur are urinary tract infections, or some people can get infections of the skin called cellulitis. And then some people can get pneumonia. And for anybody that has a port placed, it's not totally uncommon for people to get infections by their port sites. So anytime, you're feeling like a fever, or you see like a patch of redness on the body, or you're getting chills or night sweats, these are all things that need to be told to your medical teams right away, so they can evaluate you for an infection. Because yeah, that's something that generally would have to be true with antibiotics. But when people do have this, and it is a big contributing factor to their fatigue, this one's pretty simple. You just treat the infection and generally energy levels will rise. Anemia, we kind of talked about a little bit already, but anemia is when you have lower red blood cell counts and lower hemoglobin counts. And these are basically what allows for oxygen to be delivered throughout our body. So, you'll be very, very tired if this happens. You'll be kind of lightheaded if this happens. And it's potentially possible that you could like almost feel like you're going to pass out, and you will probably have a lot more shortness of breath, particularly if you're walking or going upstairs. But if you notice, especially if this happens like rapidly, like from one day to the next, you feel all these kinds of symptoms coming on, then yeah, you should definitely let your medical provider know. They'll check your blood work and just make sure that your hemoglobin hasn't dropped too low. Certainly, if you notice bleeding anywhere, particularly like dark red or I'm sorry, dark colored stool or bright red blood in your stool, then you should absolutely let your medical providers know. And again, they have to check your blood levels. And usually for anybody that does have anemia, just give them a blood infusion, and they tend to feel a lot better after that. Nutrition is a big part of it. And it's really, really common for people undergoing active chemotherapy, especially those kinds of regimens that cause a lot of nausea, for people to stop eating, and really, really common for people to stop drinking. Certainly, this is true in people with head and neck cancers, but we need calories to have energy to be able to do things, just period. So it's really, really important that, even ignoring these kinds of guidelines, just eating something and getting calorie intake while undergoing chemotherapy is really, really important. And certainly adequate hydration. And this differs for everybody. There's no one number of like ounces of water or cups of water that somebody should be getting that applies to everybody. But in general, if I had to say one number, I would say at least like 50 ounces of water or fluids per day. This is really important. This is something I commonly see a lot of people, reasonably and understandably struggle with, especially while they're on active treatment. But this is one of the kind of number one things that people can do to kind of start feeling better immediately, because I would say a lot of us are not adequately hydrated. In regards to nutritional recommendations, this is kind of the plate model that, 30% should be vegetables, 20% whole grains, 20% fruit, and 20% protein. And you really want to stay away from all this stuff. So, stay away from refined sugars or anything that has added sugars in it. Stay away from processed foods, deli meats, potato chips. Stay away from alcohol. And then, if you have questions about this stuff, you're looking for, more specific information about how many calories do I need per day? How many grams of protein do I need per day? What specific foods, should I go towards or stay away from in regards to, whatever specific medical problems I have. You might want to ask to talk to a clinical nutritionist or dietitian. And a lot of cancer centers will have these available that can give more customized recommendations. Vitamin deficiencies. These definitely aren't uncommon. And if you are having significant fatigue, particularly after you finish treatment, and you're kind of more in that later survivorship phase, then it wouldn't be a bad idea for your medical teams to maybe check a vitamin D level and a vitamin B12 level. These things are often deficient in patients, and while it's not necessarily a home run a lot of time, any deficiencies should be corrected with just supplements. Some people will feel better after, they're at a deficient level and these things do get repleted. So yeah, it wouldn't hurt to have these two vitamin levels checked if you haven't had them checked in a while. And then if you're like anemic, or you kind of have continuous anemia, also wouldn't be a bad idea to get your folate level checked or your iron level checked, as these are common deficiencies that can contribute to anemia. Okay, this is one of the big things that I would say that should be addressed in terms of combating fatigue, particularly at later stages after more active treatment, if it's continuing to go on. is medications. So
Mm-hmm.
polypharmacy is defined as the use of 5 or more medications at the same time, and this is really, really common, not just among older adults, but especially also people who have a cancer diagnosis. And a lot of the medications that are commonly prescribed cause fatigue and sedation like directly. And I would say the most common offenders are any kind of opioid medication, muscle relaxants, medications for nerve pain, medications given for nausea, and antihistamines. So if you recognize any of these medication names here, then you want to kind of continually be reassessing with your medical teams whether you still need these. Because if you're just taking it and it's not doing anything for you and just giving you side effects, then you should stop it. And a lot of times that alone, just stopping the medication will help significantly. So I would say, yeah, just be constantly reassessing the need with your medical teams, and you can ask your doctors like, hey, do I still need to take this? And sometimes they just might be like, no, you don't need it anymore. Or maybe, we could reduce the dose. So that's, what we want to do here. Whenever you can reduce doses of medications and use the smallest effective dose, you really want to do that. If there's medication you have to be on, but you think that it might be contributing to daytime tiredness, ask your doctor if you can take it during a different time. Ask them if they can take it at night, and they might say that that's okay. So, you're taking the drowsy medications at night. And this is really the big thing. Whenever you can get rid of medications, this is my favorite thing to do, then get rid of it. Because if it's just causing side effects and not helping you in any way, then yeah, it's better to just drop it. Okay, another really, really big thing. So we see category 1 here. Again, that means that this is supported by a high level of evidence that this helps, is optimizing our sleep. So if you're not sleeping well, and I would say that that means like you're not sleeping at least 6 hours at night, preferably more, like 7 or 8 hours at night, and you're getting like really restful sleep, and this is something that has to be addressed. Um, and there are a lot of different ways to address it. So there's a lot of different reasons that people have for having difficulty sleeping and not being able to sleep. And I would say that these are a lot of them. A lot of people just have anxiety at night. A lot of people don't have like the best sleep habits. A lot of people have pain. Some people have nausea and they can't sleep. But whatever the root cause is, you have to kind of tease it out with your medical teams and address that cause. Um, Now, sleep hygiene, really important to consider. These are just the habits that you have like around bedtime and going to sleep. But obviously, you want to avoid caffeine, alcohol, or high sugar foods right before going to sleep. It's really hard. I'm definitely guilty of this too, but using your cell phone in bed or taking your cell phone in bed, not a good habit. Watching TV right before sleep, having a lot of ambient light or having like a lot of sound, ambient sound. These are all bad sleep habits. Good sleep habits would be having like a really dark and quiet room and doing stress reducing activities before going to bed, like reading or journaling. So one of the good ways in which we're able to kind of improve sleep habits and improve sleep quality and time is through cognitive behavioral therapy. So there is cognitive behavioral therapy specifically for sleeping. And these are kind of the main pillars of it. So we talked about sleep hygiene, but they also do something called stimulus control, where they basically try to almost kind of brainwash your head into becoming tired when you're in your bedroom or when you're in bed, and there are ways to do that. Sleep restriction is about kind of like avoiding time spent in bed to kind of increase how tired you get so that you're tired enough to fall asleep. And cognitive restructuring is basically, reshaping our thoughts and attitudes about sleep. So these are all pillars of cognitive behavioral therapy. And this is something that's actually highly recommended across the board for people who have difficulty sleeping. So I would say if you are having difficulty sleeping, no matter what, this is something you should consider trying. And there's a couple different ways to practically do this. Muna Health is a health company that basically provides cognitive behavioral therapy with a sleep psychologist. So they'll essentially plug you in with a sleep psychologist or a sleep therapist, and you might need something like 5 or 7 sessions with them, and they do it all through video, so very accessible. And they take Medicare and most kinds of PPOs. I don't know if they take any HMOs yet, but you could certainly call them and ask. But this is something that I would highly recommend pursuing if you are having difficulty sleeping. And then if the insurance is not compatible with them, there's a kind of a different option called CBTI Coach. This is a sleep application app that's available on the Apple Store or the Play Store if you have an Android phone. But essentially, it has all the same sleep pillars there. But has been shown to help people with sleep quality as well. So I highly, highly recommend cognitive behavioral therapy if you're having trouble sleeping. Now that said, let's say you try that and you're still having a lot of difficulty sleeping, or you've been struggling with this for a long time, you just need something now, then there are many, many different medications that can be used to help you sleep, and also some supplements. Melatonin is a really commonly used supplement, as are valerian root, magnesium, CBD, which is one of the active components of marijuana, as well as tart cherry. So you could try one of these things if you're looking for a supplement route. That said, just ask your medical team before starting any of these things, just to make sure that's okay for you. And then, if you're looking for something stronger, more potent, like I said, many, many different medications. I will add a lot of these medications, not all of them, but a lot of them are habit forming. So it's not great to take all the time. However, they can be helpful if you've been really, really struggling and you just need something to help you. So like I said, a lot of different options. Talk to your medical teams. These are available and a lot of them do work well. Okay, next, category 1 recommendation is physical activity and exercise. I know it sounds kind of counterintuitive. I'm already tired. How am I going to exercise or be more active? And the answer is you just start where you are. But just, from so many patients I've seen in the past, I can't tell you how many times people tell me that just after they start becoming more active, they can do more. And it's not easy at first, but once they've been active for a longer period of time, they have more energy, they can do more things. Not true for everyone, but for a lot of people, this is true. So again, category 1 recommendation. Now, why does exercise help? Exercise decreases inflammation. So when we have kind of more fat cells, one of the bad things that fat cells do is they secrete those cytokines that can kind of cause inflammation. But when we exercise, exercise results in an overall decrease in inflammation, because when we exercise, there's anti-inflammatory molecules that get released by our cells. So, it's really, it doesn't take that long for exercise to start decreasing fat levels. And this is just one study that they did. They had a bunch of healthy young men, and they basically had them, these were healthy young men who were walking a lot, like 10,000 steps per day. And then they had them stop walking just at 1,500 steps per day. And within that 2-week period, they had an increase of 7% in their intra-abdominal fat. And again, those fat cells are what are increasing inflammation that is contributing to fatigue. So, just the more active we are, the more we can decrease that fat, decrease that inflammation. And again, there's really, really strong evidence that exercise and physical activity can help with this. So, the question is, how much activity do I need? And the answer is do whatever you can. But if you are able to, then the ideal, quote unquote, ideal amount would be 150 minutes per week of moderate intensity aerobic exercise, and then 2 to 3 days per week of strength training. The truth is, this is a lot to do. And if you can't do all of it, that's fine. Just do whatever you can. But if you can do this, this would really be the best thing. Now, for those who are just starting out and they're not really exercising regularly, then instead of doing 5 days per week, then you might want to just do 1 or 3 days per week. And instead of doing moderate intensity, you might just want to keep it really light and easy. It can be something as simple as going for a walk. And your goal would be to kind of be able to walk for like 20 minutes at a time. But the point is you start wherever you are and you increase gradually. And for a lot of people, this will increase their energy levels. Um, and what research is really showing these days is that every little bit of exercise you do counts, even if it's just like going up the stairs like a couple times a day, or even if it's just like, walking fast to catch up with the bus. All those things are helpful, and the more you do, the more benefit and energy you'll get from it. So it doesn't matter if you do a little bit, but whatever you do, start somewhere. I like to give people these intention statements where you make a plan of I will walk on Mondays, Wednesdays, and Fridays at noon around the block for 5 minutes. But the point is, you start, you make a plan, and then you try to stick to it, and you try to increase it. Now everybody, is kind of at different levels of, what kind of exercise they're able to do, and it may not be safe for everyone to do. So if you have arthritis or neuropathy or lymphedema or poor bone health, or a history of lung surgery or abdominal surgery, heart problems, severe fatigue or severe nutritional deficits, or ataxia, which is like kind of a balance issue or difficulty walking, then it's recommended that you really see a doctor to make sure that you're safe to undergo an exercise program. But if you are, then you can start on either light or moderate exercise. And there's just some different examples of activities listed here. But the difference between light exercise and moderate exercise is really your change in breathing. So when you're engaging in light exercise, you won't really have any noticeable change in your breathing. But if you're doing moderate intensity exercise, you should be exerting yourself to the point such that you can talk and carry out a conversation, but not sing. If you can sing, then you're probably just in the light exercise zone. So, this is really simple. If you're just going for a brisk walk, you can test this by trying to sing a song. And if you can't sing, but you can talk, then you're probably in the moderate exercise zone. And that's good because that means your heart is beating fast enough and hard enough for you to be getting those exercise benefits, will ultimately decrease inflammation and ultimately lessen fatigue levels. So again, do whatever you can. This is a really important thing. There are a lot of resources available for this. Silver Sneakers is a popular one. You can join Silver Sneakers. Pilates, a lot of people love Pilates. You can just go hiking. You can join a gym. If you're getting your care at Cedars-Sinai, we have a cancer exercise recovery program, and you can ask your medical providers about joining the cancer exercise recovery program at Cedars-Sinai. But just, step one, talk to your medical team, make sure it's safe for you in regards to your personal medical history. And if so, just get started on one of these things. But I can't stress enough, how common it is for people to start increasing their physical activity levels and they just start getting more energy from that. Okay, next we will move on to some not common non-pharmacologic treatments, including psychosocial interventions, massage, energy conservation, acupuncture, and bright white light therapy. And we'll notice that again, psychosocial interventions and massage have those category 1 designations. So psychoeducational therapies are basically classes that you'll undergo that will teach things like stress reduction, how to relax, and how to care for yourself. And it's unclear how or why these help with fatigue. Some people think that they may be altering serotonin levels. Other people think that they may be decreasing or altering our body's own steroid release from the level of our brain. But whatever it's doing, we know that there's a lot of evidence that these kinds of therapies help. Again, if you're receiving care at Cedars-Sinai, we have a lot of different programs that can help in these areas, such as the GRACE program, which helps to grow resiliency and courage, the RISE program, which is kind of like personalized life coaching, as well as our different educational series on different topics. And then, of course, wonderful organizations like Cancer Support Community have a lot of psychoeducational programs like this as well. So these are available. So just continue to do them. They will be helpful. Supportive expressive therapies are basically things like journaling, or being in support groups or taking part in peer counseling. And there are a lot of resources for this. Can Care is a wonderful nonprofit organization out of Texas, and they do one-on-one peer counseling. But again, a lot of evidence that this can help with fatigue. So if you don't have some type of support system, either emotionally or spiritually or existentially, then it's really something that you should seek out as part of your comprehensive approach to combating fatigue. We've already kind of talked about cognitive behavioral therapy in regards to how it can be used for sleep, but cognitive behavioral therapy can also be used to help us kind of cope with symptoms that we're undergoing, as well as for feelings of anxiety and depression. If you don't have a therapist and these kinds of mood symptoms are something that are affecting you, then it's highly recommended that you see a therapist. And a really good, easy way to find one is through this website, psychologytoday.com. It's really easy. You basically just type in like what kind of insurance you have, whether you want to see like a male or a female. And there's a lot of other filters through which you can find a psychologist, but I frequently recommend this to patients who probably need psychological support but aren't getting it currently. Massage, if you ever need a good excuse to get a massage, I would say this is one. Multiple studies were done in breast cancer patients, and this was shown to help patients with their energy levels. As long as your platelets are above 75, this is probably okay to get. And as long as you don't have like very fragile bones, like osteopenia or osteoporosis, it's probably okay. If you have any question, then you should talk to your medical teams. But this is something that can be pursued. It doesn't have to be done every day, but generally I'll recommend for patients to get a massage maybe once or twice a month. And that can be helpful. Energy conservation is the practice of basically recognizing that you have a limited amount of energy. So in light of that, you should prioritize the different activities that you have and schedule the things that you need to do, like going to someone's graduation or wedding at a time of day, where, or basically resting up and, not doing any other activities that day, and just focusing on that important activity or activities that you do daily, like, attending a doctor's visit or taking care of children that, you schedule that during times where you know that you will have more energy. So this can be helpful for some people. Acupuncture has also been shown to be helpful. You generally can't go once. If this is something you're looking into trying for fatigue, I recommend you commit to at least one session for maybe 6 weeks, or yeah, like 4 to 6 weeks at least, to give it really an honest try. Again, it's recommended that your platelets should be above 75, and you can be on treatment or post-treatment. But these days, more and more acupuncturists are taking insurance for acupuncture. So some places will take Medicare, most places will take PPO. And if you're looking for an acupuncturist, this is one website that you could consult. Bright white light therapy. So this is basically where you get a really bright light, and the idea is that it's so bright that it kind of emulates the sun. And the level of brightness that we're talking about is 10,000 LUX. These kind of lights are available on Amazon. You can generally get them for $30 to $50. But the idea behind this is it helps reset your circadian rhythm, like the natural rhythm inside your body that tells you when it's daytime and you should feel awake and when it's nighttime when you should be sleeping. So this has been helpful for some of my patients before. And if you do deal with something like depressed mood, there's also some evidence that can help with that too. So possible two birds with one stone. But generally what I recommend is that people just get a light, one of these lights, and then when you want to do this when you first wake up in the morning. So when you first wake up, you turn the light on, you sit in front of it. Don't stare at it. It's really bright, but just sit on it, sit in front of it and let it shine on you. And you generally want to sit in front of it for at least 30 or 40 minutes. And then you do that every day. And for some people, this can be really helpful. So you can't, we live in Southern California, so you can also do this by just going outside in the sun, certainly on a bright day will have 10,000 LUX, just much, much more than that actually. But it's a lot of people don't like going outside. It might be cold, and you will have to wear sunscreen. So I find that the light thing is easier. But if you really want to just go outside and like let the sun shine on you, that's totally fine too. But this is certainly something to consider. Now, if all these things aren't working, all these different strategies that we talked about aren't working, and that includes, again, taking care of any symptoms, reversing any reversible kind of causes like, sleep issues or nutritional deficits, and all these non-pharmacologic issues aren't working, then there is medication that can kind of help to directly boost energy levels. Really, the only medication that has a lot of recommendation from the National Comprehensive Cancer Network is methylphenidate. Most people know this better as Ritalin, the same kind of medication they use for people with ADHD. This can be used on short-term basis. There can be some side effects, and it can be habit forming for some people. So it's we certainly recommend the non-pharmacologic methods first. But if you were to try something first, generally it would be something like Ritalin, and that's something that you could talk to your medical team about. Another medication that we commonly use is an antidepressant called bupropion. The other name for that is Wellbutrin. So yeah, this can certainly be helpful for some people. But if you have a history of seizures or anxiety or mania, then you might want to avoid this one. And then there are several other medications too. This is these are modafinil or modafinil are commonly used for narcolepsy. And then, yeah, steroids can be used in some populations, but generally are not used. And then mantidine are commonly used in people who have had strokes. But these are all kind of medications that can increase how awake somebody feels, as well as their energy levels. But again, most evidence really for methylphenidate. There is some evidence for the use of a single supplement, Wisconsin American ginseng, which can be obtained online. There's one study that they did where they compared ginseng to just a sugar pill placebo, and they did find that people had higher energy levels after using ginseng. And this is another study which generally showed very similar thing. That said, most people tolerate ginseng okay. If you have a history of breast cancer, you might just want to talk to your medical teams about it, just because there's some kind of lab data and like Petri dishes that showed that ginseng might have some effects on breast cancer cells. And then if you're have like a sensitive stomach, ginseng might bother them. But otherwise, something that can be considered if you're trying to stay away from medications. So in summary, you want to optimize all treatable factors, particularly getting rid of any medications or reducing the dose of medications that are contributing to fatigue. You really, really want to optimize your sleep. And then, the strongest recommendations are here, but really I would say physical activity is the number one thing. But you can also consider all of these things as well. So if you want to take a picture or, keep any kind of slide from this presentation, I would note this one. But I think that's all I have. If you want to contact me directly with a more specific question, you can feel free to send me an email. This is my email, philip.chang@cshs.org. But otherwise, I'd be happy to take any questions that there are right now.
Thank you so much, Dr. Chang. If there's any questions, feel free to put them into the chat, and Dr. Chang and I can read it out loud to you as well.
Yeah, that'd be great. Thank you.
So the first question, you mentioned about the sleep aids. What about beta blockers for sleep aids?
Beta blockers are not commonly given as a sleep aid. A lot of times they'll be given for sometimes they'll be given for anxiety. Sometimes they'll be given for tremor. So if those things are contributing to difficulty sleeping, then yes, but I would say beta blockers are not super commonly given as sleep aids. But again, yeah, if it's something like, I guess anxiety or tremor or I guess like palpitations, then yeah, I would say it could be considered in maybe those regards, but I would say those are less commonly used.
When you're on your medication slide, there's a comment. I guess it's good for me that I'm already on ADHD meds for my ADHD.
Oh, yes, yes, that can, yeah. So yeah, medications like Adderall or Ritalin, yeah, they can be helpful for fatigue directly.
Yes. If
Glad to
anyone
hear that.
has, yes, if anyone has any more questions, feel free to type it into the chat. We are recording this workshop, but if you would like to unmute yourself and ask Dr. Chang a question, feel free to just unmute yourself and I can call on you. I just want to thank Dr. Chang for his time. This is such a common symptom that impacts so many of our participants in our community. So I'm very happy that you're able to speak on this matter. So thank you so much.
Yeah, of course. And like I said, yeah, if you don't want to ask a question right now, feel free to shoot me an email. If you have something more specific, I'll be happy to email you back.
Yeah, thank you for so many different strategies. So maybe one won't work, but maybe another one will. Maybe some things work for others, but another option will work better for you. So I'm glad there's so many options to choose from.
Yes.
Yeah. All right, there's quite a few thank yous in the chat. Thank you so much again for your time and everyone for joining us.